that commercial break, we were talking about how to determine, how to diagnose malaria, and of course we had a very good explanation on how it is done. And now we are back, and he will explain to us how the treatment of malaria is done after you've determined that now someone has malaria. What is the next course of action for you?
Okay, malaria treatment is based on the type of malaria. As I explained earlier, we have two types of malaria. So we'll start with the first one, uncomplicated malaria. Uncomplicated malaria, for treatment, we only give oral medication. For this case, we have what we call the first line medication, which is called artemether and lumefantrine, normally called AL in the layman language. Then we have the second line treatment is dihydroartemisinin, piperacin. We also call it pialoxine. So for uncomplicated, we only use oral medications. Then number two, for complicated malaria, this is whereby we are using either intravenous injections or intramuscular injections. So we have number one, the first line treatment for complicated malaria is a drug called artesunate. And then the second line is a drug called artemether and lumefantrine injection. All these drugs are prescribed according to the number of kgs, or how the body weight of the patient. So for the infant, they are going to get a different dose. Then for the adults, a different dose, depending on your kgs.
You've just mentioned intravenous injections and intramuscular injections. Maybe our viewer does not understand what intravenous means or intramuscular means.
Okay, but there, so intravenous means we are going to inject the drug through the vein. So the healthcare practitioner is going to identify a vein, then inject the drug through the vein. Then intramuscular, this is whereby we inject the drug mainly through what we call the gluteal muscle, or rather the behinds. So those are the difference between the intravenous and the intramuscular.
Thank you so much. Maybe after now we've talked, no, we've not finished about treatment, because earlier you had mentioned that the treatment for pregnant women is different from these other patients of malaria.
Yes. So we have that special group which called the pregnant women. For the pregnant women, we have the treatment is categorized in two phases. So pregnant women, we have what we call first trimester, second and third. For first trimester is a period in between the first, or rather the 0 week to 12 weeks of pregnancy. Then the second trimester runs from 13 week to 28. Then the third from 29 to 40. So for a pregnant woman who is, let's say, 8 weeks pregnancy, so we are going to use a different drug, which is recommended. In this case, we use what we call quinine and clindamycin for them. That's a duration course of 7 days. Then for the second trimester and third trimester, we are going to use the other normal drugs, as I mentioned earlier, like artemether and lumefantrine and the pialoxine. But in cases whereby we have come across the cases whereby you encounter a pregnant woman who is having a malaria, and she is 9 weeks pregnant. So in your clinic, or rather in your setting, you are not having the quinine. So the only thing you are going to do is you are going to administer the other medications. Of course, there is potential risk that they might affect the pregnancy, but not that way lethal. So where there is no quinine, then you should just use the other medication. Yeah.
Thank you so much. And maybe if we go back to the question about prevention of malaria.
Okay, prevention of malaria, most of the time what we should do is that these the parasites are just within our environment. Number one, we should always clear bushes around our homesteads. That's number one, because they are going to clear this infestation of those parasites. Number two, we are going to drain any stagnant water within us. Stagnant water acts as a breeding center for those parasites. So once drained, we are not going to infest those parasites. Then the next thing is all about lighting our homesteads, because these mosquitoes sometimes they are going to be hooked up in places whereby it's very dark. So once we light up our houses, open our windows very well, then we are going to achieve the prevention part of it. The next thing is about we have mosquito repellents, we have the coils, so we might use all of them. Then we have also, nowadays we have the gel. Some people have the gel, you can smear yourself with the gel so that the mosquito might not be able to bite you. So we have those different methods of preventing us from acquiring the malaria.
Some people would argue that they have tried to spray their houses, they have tried to use those mosquito repellents, but the mosquitoes are not dying per se. What would you recommend?
Okay, we have that issue about the resistance of those insecticides. You see, we are not having sometimes genuine companies which are producing this insecticide. So some insecticides are being produced in a substandard manner. So they might not achieve the effect. So most of the time we have many companies in the market and they are producing this insecticide, but they are substandard, and that's what is causing the resistance to this parasite. And also the parasites are changing. Every time we have got that thing called mutation. These parasites are changing every time. So once in the initial stage you might have the insecticide which were effective, but later they become ineffective because of change of this parasite. So those are the two major key reasons for the resistance.
Doc, maybe when we are still on that treatment and prevention of malaria, maybe you would explain to us why a person would go for malaria treatment and maybe the treatment would not work. We've seen a lot of people go for treatment, then they take the dose, maybe complete it or not, and then within the next less than 2 weeks, they again diagnosed with malaria again. What could be the problem?
Okay, a good question. There now we are tackling with something called a treatment failure. Treatment failure means that a patient has been diagnosed with malaria, a treatment initiated, but within 2 weeks, the patient is still having the signs and symptoms for malaria. So such patient undergoes a test still, the lab results comes out that the patient still has malaria. So there are factors that are causing this treatment failure. Number one is dosing. So most of the time I've come across healthcare practitioners when they are prescribing these drugs, like the AL, most of the time you will just be told just take 4 times 2, but that's not the exact dosing regime of that drug. The drug should be taken, if you take right now, you should take the drug after 8 hours. That's the next dose. Then the third dose you'll start taking 12 hours apart. But now when you just tell the patient take 4 tablets in the morning, 4 tablets in the evening, you've just skipped the dosing. So when there's regular dosing, you are going to encounter the treatment failure. Number 2, we have resistance. So some parasites are resistant to the drug. So if there is that resistant part of it, then we change, and that's where we have the second line drugs. Then number 3, we have those patient whose, let me say, they have other comorbidities. So in such patients, you see, or rather when they have such other comorbidities, or rather other diseases, they are taking other drugs. So there is that issue we call drug interactions. So there are other drugs that might lower the efficacy of the antimalarials. So in such cases, also it will cause a treatment failure. Then another case is whereby maybe a patient takes the first dose, the second dose, he or she feels that he's okay. Then the rest of the dose is just left out. So in such cases, you see that the body is creating resistance to those drugs. So those are some of the causes that are causing what we call treatment failure.
Okay, if I can explain a scenario where I have given the first line drug, my body has developed resistance to it. I go and given a second line, I still develop. Third line, I still develop resistance. What then can be done to me?
Okay, personally or rather globally, we've not had such a resistance whereby someone is going to resist to all the first line, second line. So it is something that have never been encountered. Most of the time we see once someone has become resistant to first line, then the second line will always work. Maybe, of course, I've never come across such cases whereby a patient has ever rather resisted to all the two drugs. Yeah.
Well, thank you so much. Of course, my viewer and I, we've learned so much about malaria that maybe we didn't know before, because a lot of us used to think that maybe if you get rained on, tomorrow you might wake up with malaria, and it's so good that you've enlightened us. And maybe just before I let you go, you might be having something, maybe a tip for your viewer today who's watching, just some advice on their health.
Okay, an advice concerning malaria is because one, we have that tendency of whereby someone has signs and symptoms of malaria, then he or she doesn't go to undertake a test. So in such cases, a person takes the antimalarials, but there is no change. We have other illnesses that mimic the malaria. So I encourage that once you feel that you have signs and symptoms of malaria, before you take the medication, kindly go have the test before you take the medication. Yeah.
Well, thank you so much, and I hope you'll still join us again, probably next week or the other week. Okay, that has been Jacob Owire. He's the clinical officer in charge of God's Favor Nursing Home, and he has been just enlightening us about malaria. And I hope you've gotten the advice that he has just given. I'll leave you with a few tips. Of course, protect yourself from mosquito bites. You can do that by wearing socks, long sleeve shirts and blouses. You can sleep under a treated mosquito net and use mosquito repellents if possible. If you have mosquito sprays, insecticides, you can spray in your room. And of course, close your windows and doors properly, and avoid traveling to malaria prone areas if you can. And if you have any symptoms, that is headache, chills, fever, nausea, you can visit a health facility near you. Make sure you visit a health facility so that they can actually ascertain that it is malaria before taking any drug. And if you're given drugs, follow your doctor's prescription to the letter. Do not leave your dosage halfway, or maybe take it the way you think you should take it. Thank you so much for watching. This has been Know Your Health. My name is Sylvia Nyongesa, and see you next week.